For hernias, there's several different types of hernias. You can have anything that happens on the front of the abdomen is what we consider a ventral hernia. That can be through an incision from previous surgery, or it can represent a primary occurrence through the umbilicus or the midline of the abdomen. That's just areas that are a little bit weaker congenitally. To repair a ventral hernia, we'll make incisions on the side of the abdomen, close the defect from the inside with some stitches, and also bolster that repair with a mesh to decrease the chance of it coming back. By seeing it like that, you can really see well around the outside of the defect of where the hernia is and know that you have good coverage of the mesh around the edges, which we know from studies decreases the risk of recurrence. Inguinal hernias are also common, especially in men, that occur in the groin. Those I do through a minimally invasive approach that has 3 small incisions in the midline. The largest is approximately 1 inch in length. And we separate 2 layers, bringing the muscle up and the layer over the intestines called the peritoneum down, and free up the intestine that is stuck into the defect, pull that back and block it off with a mesh that we secure at a couple points with small tacks. The recurrence rate repairing an inguinal hernia like that is probably somewhere in the neighborhood of 1.5% for a lifetime. With minimally invasive hernia repair, the recovery varies a little, whether it's laparoscopic whether it's ventral hernia or inguinal hernia. Ventral hernias, there you're pretty sore, and it's an area that you can't really relax because it has to do with contracting the core. So that one takes a little bit longer to get better from, and you have to avoid lifting a little bit longer. Minimally invasive inguinal hernia repair is a little bit easier on people. It's not a very painful operation. They're both outpatient operations, so people come in and go home from the hospital the same day. And I would say most people are back to the majority of what they want to do in approximately a week, if not earlier with the inguinal hernia, and really no lifting restrictions in 2 to 4 weeks.